Hi, everyone. Today, we're joined by Sylvana Quader Sinha, founder, chair, CEO of Praava Health, and class of '99. She founded Praava after a family medical emergency exposed how unsafe and unreliable healthcare could be in Bangladesh, even for families with resources. She left a career in law and international policy and built a new system from scratch in Dhaka, Bangladesh. I can't imagine how brave you needed to be to live a reality where you were perceived, as the goal, working with institutions like the World Bank and the United Nations and the US government to create something entirely new. A healthcare system that people could actually trust. The idea was so obviously revolutionary that Ms. Sinha raised $1.4 million in the first round of funding at the end of 2015 and have secured more than 15 million since, all from angel investors. 3 years after conception, Praava had its first medical building already functioning. In just a few years, Praava has become Bangladesh's fastest growing healthcare platform, serving over 700,000, big number, 700K, partners, patients, partnering with global institutions and major employers, setting national standards for digital health, diagnostics, and patient-centered care. Its model is now studied internationally as proof of high-quality healthcare that can build and scale in emerging markets. Beyond building Praava, Sylvana operates at the highest levels of global health and policy, helping shape how governments, multinationals, and institutions think about access to care. She's a life member of the Council of Foreign Relations and a contributor to the World Economic Forum UHC 2030, which is basically an initiative that is focused on universal health care coverage. And one of the board members also of PATH, one of the world's leading health solutions nonprofit. Her work speaks directly to the Albright Fellows mission, using cross-sector leadership and courageous leadership to solve public problems where institutions fall short. So please join me in welcoming Sylvana Quader Sinha.
Thank you so much. I think we can just show the video quickly.
Bangladesh is the world's 8th most populous country. It's also one of the world's fastest growing economies, with the GDP per capita surpassing India's several years in a row.
Praava Health is proud to be contributing to the growth and modernization of Bangladesh with an array of innovative world-class quality healthcare services that has changed expectations and disrupted the industry for the better. Welcome to Praava Health. I founded Praava Health on the belief that everyone deserves access to affordable, high-quality healthcare that they can trust. We're on a mission to change how healthcare is delivered in Bangladesh and beyond. Within the Praava system, a patient can access family doctors, women's health, pediatrics, as well as advanced specialties, including cardiology, gastroenterology, dermatology, and others, plus outpatient procedures in these specialties, as well as in-house lab testing, imaging scans, and pharmacy. We are a one-stop shop for outpatient care in Bangladesh.
In Praava, we've been able to reproduce some of the best practices that are used globally in healthcare. And this has helped us to create a unique difference in the patient experience for our Praava patients. And this has never been done before in Bangladesh.
McKinsey estimates that for each dollar of healthcare investment, low and middle income countries achieve a $4 increase in GDP. By starting our expansion journey today, we can help more people within Bangladesh and across other similar economies to change lives for the better. Join us on this exciting journey as we innovate at the cutting edges of healthcare globally, starting here in Bangladesh.
excited to be here. I was a double major when I was at Wellesley. I double majored in philosophy and economics. And anybody here with that combination? It's kind of unusual, I feel. Although in the UK they have at Oxbridge they have something called PP&E, philosophy, political science, and economics. And I did that. I spent a year at Oxford, and it was a well-accepted combination of things to study, which was interesting. I think as I think about the Albright Fellows Program, and I am also an ambassador and part of the Albright Council. It's really about the expectation that you women are going to take what you've learned here at Wellesley and the critical thinking skills that you've been taught and the worlds that you've been exposed to, and really go out and really see the world through a global lens and have an impact. And an expectation also that you're going to take responsibility for the complex world that you're entering into. And I could have never imagined that the world we're living in today is the one that that I would be inheriting when I graduated in 1999. And I didn't have a plan, actually. I didn't have a very clear, well, if you talked to me then, it would maybe seem like I had a plan. When I graduated Wellesley, I had gotten into law school and had gotten into grad school, and I knew I was going to do those things. I did go on to do those things. But I also I had a job offer. So I went and worked at PricewaterhouseCoopers as a management consultant. That was my first job. And I deferred law and grad school, and I went ahead and did those things. So it may have seemed like I had a really clear plan, but I wasn't entirely clear on how I was going to have impact in the world. I knew I had really big dreams for the things that I wanted to accomplish. I know you guys are going to be meeting with Secretary Clinton tomorrow. I actually had interned when I was at Wellesley in the Clinton White House and had worked with people at the National Security Council who had these incredible careers that had spanned both the private and public sectors and it seemed to me seamlessly navigated going back and forth in those journeys. And there was something about that definitely appealed to me, but I didn't know what that was going to look like for me in particular. So I guess when I talk to you today about my career, I think many people look at my career and it may seem like it was meandering, but for me, what really drove it was the desire to learn and grow at the rate at which I felt I was capable. And I think just trying to learn from every experience that came to me. And that is what eventually led me to what has been my life's work for the last 12 years and where I think I was really meant to be. But although I didn't have any training in healthcare and didn't have any idea that I would spend such a big chunk of my career working in healthcare. So I think, and I think you guys, I don't know, maybe when you look at my career, it seems to make a lot of sense, but I don't think careers do necessarily make sense in advance. I think they only sometimes make sense when you look back on them. And I think that's really the case for me as well. And I know that I was introduced as the CEO of the company. I'm at a moment of inflection in my career as well. April 15th of last year was actually my last day as CEO. So I'm now full-time chair of the board, and after living in Bangladesh for a decade, building my company, I've shifted back to the United States. And it's very interesting. So I'm sort of sitting in this moment of inflection and transition, but because I've done it so many times, I'm sort of comfortable with it and really excited to see what comes of this moment. So, every role that I took in my career, so as I mentioned, I had worked at PricewaterhouseCoopers. I then went to law school. I did a joint degree between Columbia Law School and the Kennedy School at Harvard, and spent my summers working in big law firms in New York, but also spent one summer working in a big law firm in India. And because I went to law school, I really wanted to practice. I wanted to have the experience of practicing and to be able to say that I really learned how to be a lawyer, although I didn't think I was going to be practicing forever. So after graduating from law school, I went and joined a big law firm in New York City. And again, I didn't pursue the most prestigious firm that I could get a job at. I went to the firm, which was it was still a top firm. It was Lovells, which is one of the biggest law firms in the world. But the office in New York was a smaller office. It was a global firm. They had a huge office in London. The New York City office was relatively smaller. But I knew I would get the chance to work really closely with senior people. And I think that was something that really served me very well, because I think if you get to work really closely with people you admire, you can really learn a lot. A lot of firms, you can end up being a cog in a wheel and stuck in a room reviewing documents and not getting exposed to the critical thinking that will really that can really help you to accelerate your career. And especially because I didn't want to be a lawyer forever, I didn't have the patience to sit and spend those years doing things that way. So so I went to Levels. I was there for 5 years. It was a great experience. I had the opportunity to learn about the area of law that relates to corporate liability for human rights, which was at the time in the mid-2000s a really developing area of law. There hadn't been cases where corporations had been held liable for human rights violations, really at that point, but there were several lawsuits coming out, particularly against oil and gas companies. And I had the opportunity to represent one of them, actually, which is never something I had imagined I would do, but I didn't think that they were guilty. And so it gave me the opportunity to learn this area of law while working in a private sector environment. And so I spent this time mostly engaged in international disputes, learning this area of jurisprudence, and then Barack Obama announced his candidacy in February of 2007, and I thought I should try to work for him. I really wanted to work with the really smart people he had around him. I actually did not think he was going to win, but I really thought he had hired Dennis McDonough and Samantha Power and Susan Rice, and I had a connection to Samantha Power through the Kennedy School. So I came up to Boston from New York, and I met her, and I said, I really want to work for you. And she gave me the opportunity. And so I worked on the foreign policy team up until the election. And it was a great experience. It was mostly remote work. I spent usually all day on Sunday working on opposition research on foreign policy. And maybe you guys are too young to remember. It was a very long primary. It really came down to Secretary Clinton and then Senator Obama until really a few months before the election. And then when he got the nomination and it became clear that he was going to win, I started to think about what I was going to do and if I should pursue an opportunity in the administration. Now, again, I had these really strong opinions about my work, and I was born in the United States. I grew up here. My life was really dictated. There was a shadow of the ability of U.S. foreign policy to influence what happens in the world. And that shadow was basically my grandfather was killed by the founding prime minister of Bangladesh. And that was after Bangladesh got its independence. And so I lived with the legends of all the stories of the US involvement in the conflict between East and West Pakistan in 1971. And so anyway, so I think I knew I always wanted to work in US foreign policy in some capacity, but I didn't know how. And I really felt, even from my time working at the White House or, engaging on the foreign policy team, I felt, a lot of the people who set policy in the United States, foreign policy, haven't spent that much time abroad. And I thought I should really put my money where my mouth is. And so, and I had not spent much time abroad. I had worked in India for a summer, I had spent time in Bangladesh, I'd spent a year at Oxford, but I thought, you know what, I should move abroad and get some experience. So I moved to Afghanistan at the end of 2008 with the World Bank. And it was an incredible experience, a beautiful country that I really fell in love with, and another great example of the challenges of US foreign policy. And it kind of was a great intersection of my interests in foreign policy, rule of law, human rights. I was managing the Afghanistan Reconstruction Trust Fund, the legal reform piece of the ARTF, the Afghanistan Reconstruction Trust Fund. The ARTF was the fund that all the donors in the world had come together to pool their resources. It was administered by the World Bank to really promote development in different sectors. So I was running the legal piece of it. And I spent most of 4 years in Afghanistan, first working for the World Bank and then working for the US government at the US Institute of Peace. I spent a little bit of time also in the Middle East. I worked for BCG on social policy, and I worked in Thailand and India for the United Nations, but most of those 4 years were in Afghanistan. And my plan had been to spend this time abroad and come back and join the administration. But I really disagreed with what we were doing in Afghanistan in particular. When I was working for the US government, I was working for the US Institute of Peace, which is a think tank that's funded by Congress. It's gotten some attention recently because it's been renamed with the current president's name. There's a big building in Washington. that's very beautiful. And it's a great organization, and it's meant to be independent. It's congressionally funded. And I used to have the opportunity to brief the rule of law. There were 5 ambassadors from the United States to Afghanistan, and one was the rule of law ambassador. And as someone working at the U.S. Institute of Peace and not at the U.S. Embassy in Kabul, I had a lot more freedom and access in the country. I didn't have any security. I didn't have like a armored car. Even when I was at the World Bank, I had this $250,000 car that would drive me around, which I thought really drew more attention to me than anything else. But so I really appreciated when I was at the U.S. Institute of Peace. I had like a Corolla, a little Corolla, and a driver. And it's not like I'm a tall blonde woman, so I could kind of blend in, if I cover my head. And so I used to, and the people who worked at the embassy didn't have as much access, but I would go and brief the rule of law ambassador. And so I had a lot of access and understanding of what was happening in the embassy and even at state. And I really disagreed with some of the things that we were doing. I felt we weren't really being clear about our goals in the country. And now, actually, one of my investors is General David Petraeus, who was the head of ISAF or NATO. And he says, well, you should have come and talked to me. And I say to him, I don't think I should have had to do that, as someone who was visiting the U.S. Embassy 3 times a week, I still had no clarity on what our policy was. And in any case, so all of this to say, it sort of then, again, pivoted my plan. I had planned to spend these years abroad and then come back and join the administration. And I got offered my boss's job in Washington at USIP. But I really thought, you know what? I miss the pace and the accountability of the private sector also. When I would come back to Washington, I remember sometimes I would show up at work at like 8 or whatever, and nobody would be there. And I thought, these are my years. I'm like in my mid-30s. I need to be working hard and learning and growing. And I don't know. I missed the pace, and the accountability that the private sector puts you through. So went back to New York, went back to big law. I was at a big law firm in New York, suing governments for corruption, doing international, arbitration and disputes, and I loved it. But I still knew I didn't want to be a lawyer forever. And throughout my career, and when I was at the Kennedy School, I was part of a program called the MPAID program, which is a Master's in Public Administration and International Development. Are you familiar with it? It was an incredible program, and if anybody's interested, I'd be happy to talk to you about that. And it's basically the first 2 years of a PhD in economics for people who want to actually be practitioners and don't want to be academics. And it's really focused on understanding sustainable development. And what I really felt, even when I was in school, was the only truly sustainable form of development is private sector development. Everything else that we could do, even when I was at the World Bank, I felt we were putting Band-Aids on things, right? And so I had seen the power of the private sector through many lenses. My grandfather in Bangladesh, on my father's side, founded the oldest pharmaceutical company in Bangladesh in 1954, which today employs many thousands of people and is publicly listed and is one of a handful of pharmaceutical companies in Bangladesh that actually export all over the world, including to the United States. And it's really an important part of Bangladesh's story, and Bangladesh is now one of the fastest growing economies in the world. And so I had seen that. Even when I was in Afghanistan, I saw the proliferation of media organizations that were having this outsized impact, radio stations, TV stations, newspapers, because the media had been so controlled by the Taliban for so many years, up until 2001. And then, private media, although there's a lot that can be said about private media in the context that we're living in the United States today, but it also created tremendous opportunity. And so I started thinking, what can I do where I can have an impact, and from the private sector side, globally. And I didn't really know what I was going to do. Around this time, I was visiting Bangladesh for a family wedding. And my family's originally from there. We would visit every few years and maintained a strong bond with Bangladesh. My parents were the only ones who left the country. So my mom ended up being hospitalized for a basic appendectomy, which, as you guys will know, is a relatively basic procedure. We were very blessed, because of our family's business, to be in the VIP suite of a fancy private hospital. But despite that, the surgery was delayed. There were a lot of complications, and we ended up having to airlift her to Bangkok for a second surgery. And a year later, she had a third surgery in Virginia due to complications from the original procedure. And it just struck me that, despite all the progress that I'd really seen with my eyes in my lifetime since visiting Bangladesh in the since the late 70s, and also knowing professionally through my work in emerging markets that Bangladesh was one of the fastest growing economies in the world, despite all this, no amount of money could afford you access to high quality healthcare. And we're very lucky we could airlift my mom to Bangkok. Like, who can do that? It's not something that's accessible to everyone, and you shouldn't have to do that. So, though I was not a healthcare person, what I did was I really threw myself into trying to figure out if I could find a way to solve this problem. So that was in August of 2014 that I decided to throw myself into it. And I'll just share like one little anecdote that was part of what gave me the courage to do it. I had been out in the market looking for jobs, looking at going in-house at PepsiCo and government relations, these interesting things. And I was also doing some advisory work for clients who were looking to make investments in emerging markets, helping them manage risk around that. And I had this, there was a woman that I was occasionally working with. She was based in Bangladesh, and she wrote me this, there were some private equity funds that were looking to do work with the garment factories in Bangladesh at the time. There was a major incident where a factory collapsed that maybe you may have seen in the news. And it was drawing a lot of attention to labor standards. And we both marveled at how little the investors knew about the market they were trying to invest supposedly $1 billion into. And she said in this email, if these big boys think they can do this, why can't we just do something? And there was something about that I was like, yeah, like maybe I should just try to do something by myself, and stop trying to find the perfect job and have looking for other people to make my dreams come true. And something about that just like gave me the nudge that I really needed at that moment. And so I threw myself into it in August of 2014, spent the next year really sort of applying my problem solving and consulting skills to understand the healthcare system in Bangladesh and what the real pain points were. I also used my global networks from my work in various arenas to go on a global listening tour and really to learn what was happening in healthcare in other countries that we could learn from and bring back and adapt to Bangladesh. Even in the United States, where I think there are a lot of reasons to argue that healthcare is broken, there's pockets of innovation. And we can learn from that, And so I really drew inspiration from many different models. And so I kind of just, I would meet anyone who would talk to me, and anyone who could teach me something. And the great thing about doing that in Bangladesh, when I was in Bangladesh, and I hadn't moved there yet, I was back and forth, but anyone I would talk to in Bangladesh had, at a minimum, been a patient. And so I would get an intake of a patient's experience, and I would ask them, well, so what do you think are the challenges in healthcare in Bangladesh? Often I would just ask that one open-ended question, and I would sit and take notes for an hour because people had so many things they wanted to share and experiences, and really heartbreaking experiences. I mean, really shocking things that had happened. I remember one person who ended up becoming part of my management team. Well, not at the time, he was hired at a junior level and then grew into management. I remember in his interview, he told me that his father had been getting headaches. And at the time, this was in the 90s, I guess, they didn't really have a lot of MRI machines in Bangladesh. So they couldn't do an MRI, but they said, you need brain surgery. We're gonna have to go in and do brain surgery. And something about that didn't feel right to that family. They're more educated. They went to India. And they got an MRI, and they met a few doctors. It turned out he had an eye infection. And in my own family, I mean, I had an aunt, just 2 stories I'll just quickly share with you that I had experienced already, even beyond my mom's experience. So my aunt and her daughter, my cousin, had gone to get breast exams, like mammograms, at one of the fancy private hospitals in Dhaka. And my cousin's results came back that she had like something she needed to look into, but she was a young woman in her 30s at the time, and so she didn't take it seriously. And then they went on a trip, like a holiday, to Bangkok. And when they're there, she's like, maybe I should look into this. So she went and got a scan, and they said, there's nothing here. Like, what are you talking about? It turned out they had flipped the scans of my aunt and my cousin, and my aunt had breast cancer and had to have 2 mastectomies. Years later, she was relatively healthy, in remission, and she had some pain in her joints, and so she went to the hospital in Bangladesh, and they told her, they did a scan, and the oncologist comes and says, you have tumors all throughout your body. We need to start radiation immediately. And because of their past experience, they were distrustful. They went to Bangkok, and it turned out she had osteoporosis. And the radiation probably would have killed her, you know. So there's so many stories like this. I could tell you so many more stories like this. So it was really shocking. And so the deeper I looked into the problem, the bigger I understood that it was. But a couple of other things happened. I also realized that there was this tremendous financial opportunity the more that I looked into it. I mean, I saw that in neighboring India, there were healthcare systems that had been built up since the 1980s or 90s, and the people who owned them were now billionaires. You know, they had scaled them up, and they had these huge brands. And when I looked at public markets, I saw that healthcare systems that scale in Asia actually trade 2 to 3 times that of healthcare systems that scale in the United States, simply due to the excess demand in those markets. So if you can build a brand, you can really scale something up more quickly and meaningfully. There's so much competition in this country now in healthcare. And then the third thing that started happening is, as I was meeting everyone, I mean, I'm not exaggerating, I would meet anyone who would agree to talk to me. I started to meet people who had the skills that I didn't have, which were many, that were needed to try to solve this problem. I started to meet doctors, scientists, health tech people, you know, and some of those people are now still part of my team, actually. And so I started to see that this could be something. You know, I started to create, you know, a small army of people, whether they were also, some were team members, some were investors, some were advisors, and it just sort of took on a life of its own. And so I moved to Bangladesh a year later, in August of 2015, and that was kind of it, you know. I threw myself into it. I closed my first round of funding, as you know, as Kate mentioned, in the end of 2015. Or sorry, you mentioned it in your introduction. I'm sorry. In the end of 2015, and then hired my first employee in February of 2016. And signed a lease for the building that you saw in the video, which was our flagship center, in November of 2016. And we cut the ribbon for our flagship center for that building in August of 2017, so 9 months later. It's one of my proudest accomplishments that we renovated that building in 9 months, because, I mean, my closets in New York, I think, took longer than that, actually. So it was a real labor of love, because we just wanted to get going, you know, and start serving patients and start learning, because the sooner you start trying to solve a problem, the more you're going to realize the things that you're doing that are not going to help you to solve it. And so we started serving patients and we had a soft launch in August, and then really a proper launch in 2018. And that video is actually, and the data is actually slightly outdated. We've now served more than 1 million patients to date. And so we're a household name in one of the biggest cities in the world, and we've done it extremely scrappily. We've raised money only from high net worth individuals and angel investors, and have really learned how to stretch limited resources and capital. And we also lived through a pandemic. We've lived through being bullied by the government. We've lived through a violent regime change in our country, which happened in July and August of 2024. And now we have an election coming up in February, which we're looking forward to, because we've had an interim government in place for the last year and a half. But it's been an extraordinary, extraordinary journey, and I'm just really grateful, to be honest with you, to have been able to do this work. And you know, there's the value of it. Of course, there's the financial value, but there's also just, I mean, I can't leave my house in Bangladesh without someone coming up to me and thanking me, and saying they never thought they could have healthcare like this. I mean, this is a country where the average amount of time doctors spend with patients is 48 seconds. And at Praava, we guarantee 15 minutes, which is really also still not that much time, but it's significantly more than the counterfactual. And so the next thing they inevitably ask is, when are you opening up on my side of town? When are you doing this? When are you doing that? And that's where my impatience kicks in, and where I really do feel badly. But I think being an entrepreneur is about being impatient. But I do want to open this up because I really would like this to be interactive. There are a lot of things that I wanted to talk about that I actually didn't get to talk about. But the one last point I want to make is the importance of being a leader. Well, the burden of being a leader will challenge you. And I think one of the things I always say about being an entrepreneur is that you get to see the best and the worst of people. Like when I worked at the World Bank or at Weil Gotshal, the big law firm, people will treat you a certain way because of where you work. When you're an entrepreneur, you're a nobody. And so people will treat you, people will not treat you that well, necessarily. And you really get to see that. But then there are other people who believe in what you're doing, who will go so far for you. And so I feel like you really get to see you really get to see who people really are. But you also really get to see who you really are, because there are always opportunities to make shortcuts. And especially operating in a country like Bangladesh, where the leadership has been corrupt traditionally. And you know, we've had instances where employees have stolen from us. We've had a couple of instances of that, and we've had to fire them. And it's always so heartbreaking, because we're trying to do something good in this world, and you know, have the best intentions. But I remember always thinking, you know, what are they supposed to do? That's what their role models are doing, you know? But I think it's important for yourself to understand what your values are, and to really focus on, for me, scaling with integrity, right? And treating every interaction as an opportunity for kindness. And I think that can be hard in the short run, but I think the credibility that can earn you in your relationships, the ROI on that is it's immeasurable. And it's why our employees are so loyal to the organization. It's why they, you know, they've lived with us through all of these moments of challenge. When the pandemic hit, I couldn't pay salaries for 2 months. We had a funding round fall through, and I didn't know what I was going to do. Honestly, we may not have survived. But our employees, because we had doctors, nurses, lab technicians, we volunteered our services to the government. We were collecting samples for the government lab. They weren't allowing any private labs to do testing yet. We were the first to partner with the government on their free hotline, which was a telemedicine hotline patients could call to talk to a doctor. And our employees kept going because they knew they had something to offer the community during this time, and they were still proud to be part of our organization. And then, and we also, through building this goodwill with the government, ended up being selected as one of the first private labs to be permitted to do COVID testing, which became a game changer for us, both from a brand perspective, but also, frankly, from a cash flow perspective. We were able to pay salaries again. Anyway, so that's just one small example, and I'll leave on that note, but really excited to have a deeper conversation with all of you. I think I'm gonna now hand the mic over.
Do we have questions?
Hi, it's really great to meet you today. My name is Maya, and I'm a biochem major and a senior, and also hoping to be a physician in a few years. Yeah, and so I'm really excited to hear you talk about healthcare today, and I wanted to ask you if you've developed any community-based programs with your hospital and how you engage with the community beyond just the patients that you serve.
That's a great question. Can you guys hear me on this? Okay, great. That's a really great question. So I think I mentioned some of the things that we did during the COVID, during the pandemic. We do a lot of what we call health camps. So for example, we'll partner with, recently we did a project with another NGO in a local slum area where we did eye screenings for children. So we'll volunteer our services in these ways. One of the things we do at a broader scale is there's an NGO that works with women all over the country and actually provides microfinance solutions to them and also offers healthcare services to them. So we offer we do lab testing for them all over the country at cost, actually. So we bring the cost down to as low as we can possibly do it so that we can be able to serve these communities. And it actually has a benefit for us as well. The more volume we drive into our lab, the more our unit costs go down. But we're always really trying to push ourselves to figure out ways we can do things like that that can help us serve a broader segment of the population. We also have membership plans. Membership plans are a very small part of our business. This is a country where people don't really pay for insurance. I mean, only 1% of the population has any form of insurance. So people aren't accustomed. The culture of prepaying for care is not there yet. But we've developed membership plans where you pay a flat rate for unlimited access to services. And there are some very expensive plans. And when I say very expensive, it's like $400 for unlimited care over the course of the year. That includes testing and unlimited visits. But then there's a plan that's very inexpensive. I think it's about $40 based on the current exchange rate that offers unlimited visits. And so basically what we do is we've developed sort of a sliding scale. So people who cannot afford the very expensive plan can afford our margin on the lower plans is almost not there because the more expensive plans subsidize that for us. So it's kind of a cross subsidy.
Hi, my name is Catherine, and I am also hoping to become a physician. I wanted to ask if there was ever consideration for you to just go into the local communities and hospitals to revamp the existing healthcare systems, or what was the motivation to start from new, start from scratch?
So that's a really, really great question, especially because if we step back and look at the journey of Bangladesh over the last 40 and 50 years, it's really pointed to as a development miracle. And I don't know if anyone has studied this in their economics classes, but I mean, in 1971, when Bangladesh got its independence, Henry Kissinger called it a basket case and, it was expected to collapse. But the NGOs really rose to the occasion. And when I say the NGOs, I mean organizations like the Grameen Bank, founded by the current head of state, Professor Yunus, and Nobel Prize laureate, and BRAC, founded by Sir Fazle Abid. Those are two of the largest NGOs that were both founded in the 1970s, and they ended up doing a really excellent job offering community-based development. And a big component of that was healthcare. And through that, in one generation, the poverty rate came down. I think it's now less than 20%. And maternal, newborn mortality rates are lower than any other country in the region, actually, which is really remarkable. And life expectancy is more than 74, which is, I think, higher than parts of Boston, And so on the public health side of things, when I mentioned I did the global listening tour, Bangladesh was one of the models I actually looked at. And the very interesting thing is primary care in the rural setting is a huge priority because of these community development initiatives. And these NGOs often operate the clinics for the government. And when I first started the company, I knew this global health reporter, and I met up with her. And she's been to more than 120 countries in the world. And she said to me, Bangladesh is the only country I've ever visited where the government has completely abdicated the responsibility for the health of its citizens to the NGOs and the private sector. So there's this divide, basically, I would say. The NGOs are providing a lot of care at the community level, and then there's the private sector opportunity. And so when I started out, what I saw was the gap was in the private sector. Because Bangladesh is this fast-growing economy, and you have millions of people who are entering into middle-income status, and they don't want to go to the public clinics and the public hospitals. And in fact, of the masses, 35% of them don't want to access healthcare for the first time in the public system. For the first time, they enter the private system. So the private system, unlike in many other countries, in South Asia, the private system is the bulk of health spending. So in Bangladesh, it's 72% of health spending that comes from the private sector. In India, it's 66%. It's the inverse in the United States and in most other countries, most advanced economies. In Africa, parts of Africa, it's similar to South Asia. And so that's one part of it. So what I observed, and the data suggests, is that the middle class is actually the underserved segment of the population in economies like this that have like such rapid growth. It's called a missing middle problem. And I would argue we even have it here in the United States. I mean, the middle class often gets left behind of these types of initiatives. And in fact, I saw this one study when I was starting the company that urban women in Bangladesh know less about family planning than rural women, which is incredible. And so that was really why I picked the middle class as the segment of the population that I wanted to focus on. Any other questions? I think there was one over here.
Thank you for speaking with us today. My name's Julia. I'm also hoping to be a physician in the future.
So how many people here want to be doctors? I'm curious. That's so interesting that you guys are doing the Albright program. I love that. That's excellent.
But I'm also really interested in health economics, and I'm actually also an econ major. But I was wondering, since in the U.S. here, preventative care and screenings are sort of limited in terms of like the guidelines of who has access to them. Like for lung cancer screening, you have to be within a very specific age group and have been like a smoker for a very like extensive period of time. So I was wondering, in Bangladesh with Praava Health, how do you decide who gets preventative care? Do you come up with your own guidelines? Is it what the government does? And have you been able to seen the long-term payoffs in the time that Praava Health has existed in terms of like decreased like recurrence of different diseases?
Yes, great question. I would say, first of all, we have to step back. So Bangladesh is a country where most people are buying healthcare out of pocket. There's no insurance. So there's no guidelines to dictate who we get to give a health check to. So it's really more about the patient self-selecting, or patients will walk in and say, some patients, they just want to do blood work. Some patients, they don't want to see a doctor, they just want to do blood work. We always recommend with their first blood work that we'll give them a free appointment to a doctor so they can see the value of having their care managed by a family doctor. But many of them just prefer to just do their own testing. And so the guidelines that we follow are the NICE guidelines, which is the UK government's guidelines. And those are the clinical protocols that we really follow. But we're not the ones who are picking because we don't have a third-party payer, right? It's the third-party payer system that dictates the kind of system that you're describing. In terms of the outcomes, what we've seen is that Praava patients are less likely to be hospitalized than other patients. So right now, one of the problems that we really wanted to solve, which I didn't get to address fully, is that private healthcare in Asia is largely unregulated. What we talk about in the United States often is that care is overly hospital-centric. It's so much less so than in Asia. And because private care is less regulated, basically, the incentives that exist are to drive patients into the hospital, right? In the United States, I will say now, because of value-based care, because of the way insurers are thinking about care, we do try to reduce the volume of time patients spend in the hospital. There's more and more outpatient, outpatient procedures and surgeries that are happening, and that's been forced. The forcing mechanism for that has largely been insurance. When you don't have that kind of a forcing mechanism, it can become a free-for-all. So, for example, when you arrive at a hospital in Bangladesh, the person checking you in a private hospital, the person checking you in has been given a target to convert you from an outpatient to an inpatient. And once you're in the hospital, the doctor has been given a target to keep you in the hospital for a minimum of 3 days, because that's when they make the most money on the testing. It's not at all about what's best for the patient, which is why we very intentionally really wanted to build an outpatient healthcare system, the goal of which was to keep people out of the hospital. And what we've seen is that we've been able to accomplish that.
Hi, I'm Samiksha. I'm actually really interested. Yeah, first of all, thank you for speaking to us. I'm really interested in the entrepreneurship side. So I was wondering, especially like, how do you build credibility when you go into like a new market?
Yeah.
Because with your career pivot, especially, because I feel like you went to law school here, you had your network, you had like people you could talk to. When you like start from scratch, essentially, in Bangladesh, how do you like convince, I guess, like your first employee to believe in you? How do you like reach out to people to know how things work? And yeah.
It's a really great question. And it's a topic I think about a lot, especially one of the themes of this for me that I didn't get to talk about is that I moved to Bangladesh for the first time in my life. And although people knew who my family was, a lot of the time they didn't know who I was. And so like I think you may have read the HBR article. I describe it. I was not an insider, but I was not an outsider. And so people sort of had ideas about who I should be or who I would be. And I think broadly, I was dramatically underestimated because I was a woman and people were like, who's this chick? She's not going to figure this out. Like, it's so hard to do healthcare, which all of those things are true. None of the things they doubted me for were not true. But I think being underestimated really allowed us to fly under the radar. But where I did need people to not underestimate me, as you described, is in building my team, working with, like, convincing investors to give me money and to trust me with their money and their investment, and then partners. And I think that, I joke with my lab director, actually. He's still our lab director at Praava. And he used to interview me. Like, he would take me out for coffee, and he would just grill me, like, for, I think it was, like, weeks and weeks and weeks. And it was fair enough. But I joke, like, I was like, you were interviewing me. Because there are a lot of people who, from the diaspora who will go back to their home country and, like, say they want to do something, and then they leave in, like, a couple months because they don't really care about the problem they're trying to solve, or they don't like living there, or, like, whatever the reason. And so I think it's like trust there's no substitute for building trust than spending time. And the other thing, I often wish, when people ask me this question, I often wish my team could be here because they can tell you more than what their experience was. But I remember one of them, we had an investor visit, and, like, somebody asked a question along these lines, and it was a former medical director, who was my first hire. And he said, like, she knew her stuff. He's like, even though she hadn't worked in healthcare before, I spent a year, like, really, like, trying to understand, like, dig deep and become an expert in these things. And I think all those meetings that I did also, like, with investors and other people globally, I learned so much from those meetings. And there were some of them I stumbled. I didn't have the answers to their questions, but I think being really diligent, and these are the things that Wellesley really teaches you, right, is just being really diligent about knowing the answer to any question you might get asked, and being open to failure, being open to doubt, and learning. So there's no substitute for that. Even with investors, I had one investor, Omar Ishraq is one of our investors. He's Bangladeshi. He's probably the most successful Bangladeshi businessman in the world. He was the chair and CEO of Medtronic, and then the chair of the board of Intel. I courted him for 6 years. So the other thing is never giving up, and just like things. These are long-term plays. Relationship building can be a long-term play. And so I remember I first went and met him in 2015 in his office in DC, and I just kept in touch with him. And I didn't harass him. Maybe it might have seemed like it, but he always wrote me back. You know what I mean? He always still seemed to want to engage, and I would hear him speak, and sometimes he would talk about me and Praava, and so I was like, okay, I think he likes me. I think he likes what we're doing, and then eventually he did invest, and now he's a great champion for what we do.
Hi, thank you for speaking with us today. I think I read in your article that you lived in Roanoke, Virginia.
Yeah.
Yes, I'm from North Carolina. I'm from North Carolina, but like
I never meet anybody from Roanoke.
Well, I worked like an hour and a half from Roanoke this summer in Wise, Virginia, in Appalachia at the Health Wagon, which is like I don't know if you've visited them at all, but
no, I haven't. I've been to Wise before, but many, many years ago.
Well, it was fun. It's I'm from a small area too, and so I really appreciated the work that Health Wagon does, like to provide healthcare for areas in Appalachia who have especially been affected by big pharma and targeted by the opioid epidemic as a result of like exploiting the land for industry. And I see the compassionate work that they're doing at Health Wagon, and I was there when the One Big Beautiful bill was passed. And hearing about all the cuts that would be coming to rural healthcare through that, as well as but the thing is, for the Health Wagon, is they're funded by religious institutions. So the funding's a little bit more stable. But I see the work like that, and I see the work that, like, what your organization is doing to, like, limit the amount of cost to patients in the private sector. But I also see big pharma who caused the problems that HealthWagon is having to like counteract.
Right. Absolutely.
As well as like insurance companies that are also making healthcare more challenging and inaccessible for people. And so I'm wondering, like, both of those things are existing in the private sector. And I'm wondering where you delineate creating like institutional ways to have more accessible healthcare when that kind of private sector is also used to like decrease accessibility. Because I wonder like how much it could be the intention of the person who's entering the private sector as opposed to what mechanisms exist to allow for more compassionate healthcare.
Right.
I don't know if that makes sense. That was a ramble.
It does make sense. I mean, I do think the U.S. is different because of the power of the lobby of insurance and pharmaceuticals. I just got here. I was just in California, actually, at the JPM Healthcare Conference, which is the largest healthcare investing conference that happens every year, and it's always this week. And yeah, I mean, I think that U.S. healthcare is really its own behemoth in terms of, you know, the things that we need to shift. I mean, I sat on a working group at Mount Sinai. It was called Global Advantage, and basically bringing in perspectives of healthcare systems in other markets and to try to learn. I mean, the U.S. spends 10 times per capita what Cuba spends for the same level of outcomes, right? And so what can we learn from those models? What can we learn from Bangladesh achieving this incredible, you know, life expectancy and social development indicators? Ultimately, I felt our work product was sort of useless because it's not that we don't know the things we need to do. As you say, we know we need to invest in primary care, right? We know that when women have access to healthcare, you get better outcomes for families, right? I mean, these things are known, but as long as the insurance and pharmaceutical lobby are what they are, like nobody in Washington is empowered to really try to change things. So that's my opinion broadly on that challenge in the United States. In terms of building incentives in Praava that fight against some of those things that are in place, they're definitely in place in other markets as well at different levels. One of the big things that I think drives corruption in healthcare in Bangladesh is the referral fees that get paid. So that's like, you know, in the US you have like pharmaceutical reps that go and talk to doctors and give them presents and send them on trips. And there's a lot more regulation of that, I would say, in the last couple of decades than there was when I was growing up. But it's still there. And in Bangladesh, it's completely unregulated. And and pharmaceutical companies and diagnostic centers will pay for sample, like, so basically, like, and we have a side of our business that's like the referral, and in fact, Quest Diagnostics is a great example. So when you go to your primary care physician's office and they draw your blood, Quest analyzes the blood gets sent to Quest. Quest pays your doctor's office for that sample. Now, what that can do is encourage your doctor to over-order you testing. And that is what's happening in Bangladesh. So within Praava's system, we've gotten rid of those referral fees. And we don't allow any pharmaceutical reps on site either, because the same thing happens on the pharmaceutical side. So those are some of the little things, the nudges that we've tried to introduce to prevent that. The really interesting thing is, even though our doctors don't get any kickbacks or incentives for ordering drugs or tests, when they first come to Praava, they often still do it, because that's the system that they came from. But we audit them, and we just ask them, okay, like, are you sure you needed to order XYZ, you know? And so we have a board that reviews cases in that way. So I hope that's helpful. Yeah.
Hi, my name's Talia. I'm really interested in your investors and how you said there's only angel investors and then individuals, and especially coming out of the JPM investment conference. I was just wondering, do you purposely choose to only have these individuals, or is that just a healthcare thing? I guess I'm just interested in that.
Well, I mean, we could spend a lot of time talking about the answer to that question, but the short answer is there isn't institutional capital that's focused on early stage healthcare in emerging markets, which is very, very sad. And that's not, that was a lesson for me. I expected, once I proved the unit economics of my business, there would be investors lining up to try to invest in my business. But that has not, unfortunately, been the case. I think that, and what I think is particularly disheartening is that this is the case after we lived through the greatest global health crisis of our lifetimes, and we hear a lot of talk about how interconnected the world is, and we hear Bill Gates writing in the New York Times about pandemic preparedness, which is actually not as big a threat to the world as non-communicable disease mortality. But the things you need to do to fight both things are the same, which is build primary care, build labs, build advanced testing capacity like genomics and more advanced testing in labs. And anyway, so nobody's funding those things is the real truth. The vast majority of healthcare investment that's happening in the world is still happening in the United States. And it's very interesting because I used to go to JPM, that same conference pre-COVID, and funnily enough, it was more global before the pandemic. It feels like it's gotten even more US focused post-pandemic. And yeah, the trends in investing in healthcare globally have not moved in the direction of businesses like mine in particular. Yeah, I have a lot of other opinions about this topic, which is why I said we could talk more, but I will also say venture capital has been an enabler of businesses like ours that exist in the United States. 80% of venture dollars go to companies headquartered in New York, Massachusetts, and California. So that's a whole other story. It's like venture is also very US focused. But I'm not convinced that venture capital is the right asset class for healthcare anywhere, because creating systemic change in healthcare takes time. And the timelines that venture capital expects things to move are very different. I have the same opinion about AI in healthcare. You can't apply the same things to healthcare as you can to other sectors, because the risks are just so much higher.
Hi. First, everyone was giggling because this is one of our teams. So it's something we're analyzing as a group.
What are you analyzing?
There's a group taking care of AI for good in India.
Oh, right, cool. Yeah, I think I offered to speak to them, but anyway, I'm happy to talk to you guys if that's helpful. Yes, I do think it can be done. It's not that I don't think it can be done, but I just think we need to be careful.
Yeah, and I think it's a lot about, thinking about things, and I was very inspired by the video that you showed at first, especially because it gave me an idea of expansion. I don't know if that's your pitch for the investors, but that felt like something to invest in. And I wanted to understand better if, am I mistaken that there was a call for expansion in the end? And if that expansion would be in terms of continuing education, so in the support of bringing this professionals, because when you told us about everything that was going on in the hospital, I just thought, well, that requires a huge level not only of conflicting interest, but of ignorance. I've been a nurse in my country before I came to Wellesley, and there's a lot to the regulations, what we do in Brazil, because Brazil is just crazy about healthcare. I'm very grateful for that. But it's also about the type of how regulated and very strong is the healthcare education. I would say that to become a doctor in Brazil, you can do it through a bachelor's, but that's a great deal. Very few people are able to do so, and I imagine that it must have been challenging when building Praava to find the not only the professions that aligned with your values, but were also up to what you expected of excellency in education. So I wonder if that expansion is somewhat related to continuing education, or if that would be more about scalability. Because I also noticed how Praava is very personalized to the Bangladeshi culture and society, and I think that's amazing, but it's also challenging if you were to build Praava somewhere else, because you would need to evaluate that market so much more. So I think it's a long question, but it's what I'm interested in. Thank you.
Yeah, I mean, I think that absolutely human capital is a major area that we invest in, and it's a major component of our plan to scale. Because a lot of the people who come to us, I mean, I don't know, I know a little bit about Brazil's healthcare system, but for us, we have to train everybody who comes to work at Praava even though they've already gotten their degrees, right? Because we want to make sure that they're operating at our level. I mean, we will have evaluated them, and we have our own metrics for doing that. But once they come to Praava, we also have a way of training them so that they're delivering care within our vision of the way that should be done. And so training is a big component of it, as you mentioned, continuing education. I mean, I do think there's another business plan to be written about setting up training institutes. And in fact, the doctors' shortage in Bangladesh is actually not as bad as the nursing and technician shortage. Most countries are like a pyramid like this, where you have the largest number of technicians, then nurses, then doctors. Bangladesh is like this. So anyone who's like at all intelligent is encouraged to go to med school. They're not going to go to nursing school, unfortunately, even though nurses are such a critical part of the way care, needs to be delivered. And so that would be my question to that. I think in terms of scaling to other markets, I don't think that should be taken lightly. I think this model can work in other markets, but not in Brazil, not in India, not in China. So next level emerging markets that are at a similar stage of development as right? As Bangladesh, sorry. And so like maybe Malaysia or Nigeria or Kenya, where I think, again, there's a lot of fragmentation around healthcare and an opportunity to build a vertically integrated model like this that can fill a gap. Okay, sure. One more question. Or I think there's two. Can they just quickly, we can just go together and then I'll answer. Yeah, okay.
Thank you. My name is Mercy. One of the questions that I had, two of them have been answered, so I'm really grateful for that. One of the questions that I had was like, you built this company by actually making sure that the first thing that healthcare people do care about is the patients. And I wanted to ask, when you are thinking of giving up your CEO position and letting another person run it, how do you make sure that your vision is not lost, even if you're actually not there actively?
Yeah. I mean, that's a really great question. And again, another topic that could be the subject of an entire conversation probably. But my successor is someone that I've known. I've known him since 2015 when I first moved to Bangladesh. He was one of the conversations I had when I first moved to Bangladesh. He was the founder of the first health tech company in Bangladesh, which was ZocDoc for Bangladesh. It was called Dr. Rolla. And I really liked him so much when I met him, and we just really hit it off and had the same values in terms of what we wanted to accomplish in healthcare in Bangladesh, although coming at it from different perspectives. He faced challenges in his business. I think it was a little early for that model in Bangladesh. And he became part of my management team at this time almost 4 years ago. So I knew him really well. I had known him for like in-house, working at my organization as the C-suite executive for 3 years. And so it was somewhat de-risked in that way. But I took 9 months. I mean, like I talked to him in July of 2024, and we didn't enact it until April of 2015. So we took quite a while to make sure we had all the right pieces in place to set him up for success. And then there's the accountability that persists, right? I have calls with him. I mean, I have a call with him on Thursday. I speak with him almost every week, if not, definitely every other week. And we have quarterly board meetings, and so there are certain KPIs against which we measure our success. One of the really critical ones is Net Promoter Score, which reflects kind of the patient experience that people are having at Praava. And then there's also Employee Net Promoter Score, which reflects how people feel working at Praava. And so those are two of the really critical ones. Of course, there's all of the regular financial benchmarks that are also really key. But yeah, that's the quick answer. Sorry, just quickly.
Hi, so I'm actually part of the group that's doing AI in healthcare in India. And I just had a kind of quick question about what we've kind of been contending with in sort of making this presentation. I think that a sentiment that's kind of come up is the implementation of AI in healthcare kind of being like a Band-Aid for a bullet wound in a lot of ways. And yeah, I just wanted to ask, I guess, what has been like the landscape of implementing AI-driven health tools in Bangladesh, if that's been something that's come up, because obviously in India there's been robust investments to AI. So I just was wondering to get your perspective.
Yeah, so I think AI, at Praava, AI has had the biggest impact on the operations side and really on the kind of the business side of things, helping us to predict patient volumes, helping us to better understand what kind of products patients are seeking. We actually use AI to analyze all of our call center data. So it's been helpful on the operations and marketing side in particular. On the diagnosis and treatment side, we did build a tool during the pandemic for remote care for management of basically once a patient tested positive for COVID, they could enroll into a system that was built onto Facebook Messenger. Because one of the big issues I have with AI for health is that there are 3 billion people in the world who don't have internet and 1 billion who don't have power. So if we're only investing in this AI stuff, like we're not solving those problems. And so the health equity challenges are real, right? So at least by building it onto Facebook Messenger, a lot of people in emerging markets have something called a feature phone where they only have like 3 or 4 apps that can run on it, but one is almost always Facebook in Bangladesh. So we built this tool on Facebook Messenger, and they would self-report biometrics. So based on self-analysis, like how breathless are you, things like that. If you have a pulse oximeter, like what is your oxygen level? And that data would be analyzed through an AI and machine learning tool that would get escalated to our medical team, which would then determine whether they should message the patient, call the patient, do a video consultation, or tell them to go to the hospital. So I think that these things, it can be useful, right? But it has to go hand in hand with a really hands-on approach from a doctor. And the really interesting thing that's happening with the ChatGPT for Health thing is that people in Asia they're uploading their medical reports to ChatGPT, and there's massive risks with it, but more so here in the US because of HIPAA. Right? It's actually in emerging markets, I think there's opportunity for patients to be more engaged in managing their health and to just be more educated about the kind of questions they should. I mean, I've used it where I'm like, well, what should I ask my doctor about this, you know? And I think for us, healthcare is much too doctor-centric, and I really want to, my vision for Praava was to shift care into the patient's hands. And so I think AI can be a great tool to enable patients to really take control of their health.
Thank you so much, Sylvana. I'm sure we could have gone for 3 hours. Thank you. Sylvana has requested we do a group photo with her, if that's...
Yeah.
Yay, great. So you know the routine, fellows. And then just to say, we will be back in here at 2:40 for our 2:45 session.